What's up, guys? Today we're gonna be looking at osteogenesis imperfecta using the following outline: introduction, stroke definition, causes, clinical features, types, pathophysiology, consequences, and management. Osteogenesis imperfecta, often called brittle bone disease, is a genetic disorder of connective tissue characterized mainly by fragile bones that break easily, often with little or no trauma. Here you can see the picture of a healthy bone with normal density, and here you can see a bone which is brittle. You can see how it has lost most of its density, showing you that if if there is little or no trauma, this bone could result into a fracture. What are the causes of osteogenesis imperfecta? Most cases are due to mutation in the COL1A1 or COL1A2 genes. These genes code for type 1 collagen, a key protein that gives strength to bones, teeth, sclera, and ligaments. Defective or reduced collagen results into weak bone matrix, which will further result into frequent fractures. What are the clinical features of osteogenesis imperfecta? We have bone fragility. Usually, there are recurrent fractures, deformities, and short stature in people suffering from osteogenesis imperfecta. You have blue sclera due to thin collagen in the eyes. You have hearing loss, that's otosclerosis affecting middle ear bones. You have dental problems such as dentinogenesis imperfecta, which results into brittle discolored teeth. We have joint laxity and easy bruising. We have severity varies widely from mild to lethal in perinatal period. What are the symptoms of osteogenesis imperfecta? Here we just have an overview of what you expect to see in osteogenesis imperfecta. You can see the discolored teeth of someone affected with osteogenesis imperfecta. Usually the teeth is discolored and soft. The blue colored sclera of the eye, and you can see chest deformity right here. So now we'll go to types of osteogenesis imperfecta. We have type 1, type 2, type 3, and type 4. The type 1 is mild, most common. You see them, they have a normal stature, though their fractures decrease after puberty. The type 2 is most severe, often lethal at birth. The type 3 is severe, progressive deformities, very short stature. You see them, they are very short. Then the type 4, you have moderate severity and there is variable presentation. The presentation is neither here nor there. Here we have a classical view of what osteogenesis imperfecta looks like. This is the type 1 in a female who is 38 years old. You can see how the arrangement of the bones, how they are deformed. And this is the same type 1 in a 63-year-old patient. You can see how the hip bone is, the bones are malformed. And you can see the type 4 in a 40-year-old male. Here you can see the deformity of the chest, how the vertebral column is malformed. In the type 4, in a female who is 35 years, you can see how the vertebral column is malformed, it's not straight. Look at chest deformity. You can see the inward appearance of the femur. Then in type 3, in a female of 27 years old, you can see there is chest deformity, there is deformity of the vertebral column. You can see how the bones of the hands are. And then in the type 3, in a male of 40 years old, you can also see the deformities. So these are usually things you should expect to see in osteogenesis imperfecta. What is the pathophysiology? Normal bone strength depends on type 1 collagen, which forms the structural framework of bone. In osteogenesis imperfecta, there is mutation in the COL1A1 or COL1A2 genes, which would either lead to quantitative defect or qualitative defect. In the quantitative defect, there's reduced amount of type 1 collagen. That is what results into type 1 osteogenesis imperfecta. Or there's qualitative defect, that's structurally there's abnormal collagen. Here the collagen is actually formed, but the structure is unusual, is abnormal. It usually results into type 2, type 3, or type 4 osteogenesis imperfecta. What are the consequences of osteogenesis imperfecta? You see, when there is a defect in the gene coding for collagen formation, you expect to see weak, poorly organized bone matrix. There's thin cortical bone, there's reduced trabeculae, and abnormal mineralization. Bones fracture easily under minimal stress. Collagen defects also affect other tissues like the eye, where you see blue sclera, the teeth, where you see dental fragility, joints, where you see joint laxity, and then there's hearing loss as well. What is the management? Till now, there is no cure for osteogenesis imperfecta, but treatment focuses on biphosphonates. That's the biphosphonates, when administered, increases bone density. You give care for the fracture, and then orthopedic surgery can be performed, which rodding is done to prevent deformities of long bones. There's physical therapy and rehabilitation, which strengthens muscle and improve mobility. You can also give hearing aids through dental care as needed to patients with hearing disorders as a result of osteogenesis imperfecta, or people with soft teeth as a result of osteogenesis imperfecta. There's also genetic counseling for families. This is to prevent further effect of osteogenesis imperfecta in the family. Thank you for listening.